dais with honorable persons here, Professor Dr. G. Mohandas Nair, Dr. C. Ananda Ramakrishnan, Dr. C. N. Ramachandra, Shri Pradeep K.S., who is convener of the State Level Bankers Committee, Dr. Deena Das, Chairperson of Dale View Group, Shri G. Kumar, Principal Dale View College of Pharmacy, all other dignitaries sitting in the audience, faculty members, professors, researchers, students, and all other participants from different countries here. Namaskaram. Sahodaran Mare, Namaskar. As we already know why we have gathered here. The gathering itself is of people who are somehow related to medicine or pharmacy. And all these people are here who have gathered to deliberate something. The only odd man here, as you are sitting here, you will be deliberating on different aspects from today, tomorrow, and day after tomorrow. Today being inaugural function, you are little bit fresh and you will be accepting whatever I say. But the real test of yours will be starting after this session. You have different topics which relate to the pharmacy, which relate to the medicine, and ultimately it relates to the human factor. In our country it is said, Jivet Sharada Shatam, means every human being has to live at least for 100 years. And that is the blessing, that is the Ashirvad given by our ancestors, who always taught us, give Ashirvad or blessings to others in this form, Jivet Sharada Shatam. So 100 years we have to live. That is what is expected from us. Now the question comes, if the humankind and humanity, all those ancestors of ours, they expect us to live 100 years, which are the means to live 100 years? Which are the forms? What are the requirements to live 100 years? In fact, if we go just little bit behind, the ancestors of ours, they had a lifestyle which is different from today's lifestyle. And probably that lifestyle prompted them to live for 100 years. Today we need to listen to others because of our different lifestyle, and we have to say, you try to live at least 80 years, try to live at least 100 years. What is the reason behind this? All our medical innovations, all our pharmaceutical researches, all are directed toward lengthening of our life. Why do we need all these researches? Why do we need the medicines? To have a better life. And what is that better life? That has to be defined by us. Because otherwise we will be doing medicinal research or all other research in a theoretic manner. It will just be we will be doing something and we do not bother whether it is giving us the results which we want. So that is how we have to look at the whole problem. We all are here researchers, as I say. Some of you are students also. Ultimate our goal of our all research, all our innovations, all our studies, all our reports that are being presented, all the papers that will be presented here, we must try to understand ultimate goal of that. Ultimate goal is our well-being. We want to keep ourselves intact, our physics as well as our mental thoughts. All those mentally as well as physically we have to be intact. That is the whole research is targeted at. So ultimate goal is keeping yourself intact. Ultimate goal is keeping yourself in a better way, which way we are living yesteryears. So all of your targets are here for the human being. And if we do not have that human factor within us, everything is lost. All our researches, all our innovations have to be in the interest of the common people. They are supposed to be given to better life to the people who are standing there on the streets, who are there, who do not have proper medicines, who do not get proper medical care. All these things are directed towards him. That is the reason why people like you, who are intellectually very high, who have completed all your studies, are sitting together, putting your heads together to get better results for that person who is there, whom we have not met yet. For him, we are doing here all researches. For those persons, we are sitting here for 3 days continuously. So that is what we have to understand. And ultimately, if we do not understand his apathies, if we do not understand his problems, all researches, all sitting together, all deliberations are of no use. So we must understand what our inner voice tells us. Inner voice tells us, do something for the people. Whatever heights I may be attaining, whatever all the fame that I may be gaining, but all is that for the society, for the people in the society who need our researches, our attention the most. We have to do that. If we forget that human factor, it will be of no use. As they were telling that I have been governor in Bihar also. I was governor in Himachal Pradesh also. Himachal, Bihar and Kerala. All three different states, different environment, different atmosphere, different people. And all they have contributed toward one factor, that is humanity. When I was in Himachal Pradesh, I was traveling along with my ADC. ADC always helps me to say something and do something, all these things. So he was traveling with me from Shimla to another place. So we were traveling, it was about 2.5 hours drive. So we were just thinking what to speak on this. Suddenly my ADC asked me, sir, I want to ask you one question. I said, please, very please. I also wanted some change. Everything was there. I was looking out and everything. Shimla is a beautiful place. Many of you must have visited also. If not, please go there to see the snowfall and everything. So suddenly my ADC asked me, sir, how to become a good politician? I was surprised. From where you got this question and from where you get these thoughts, I did not understand. So I asked him, what is the problem? No, you were a politician, he told me. Yes, I said, I was. I'm not now. As I became a governor, I'm not a politician today. So suddenly he asked me, how to become a good politician? I was surprised. But my earlier years were as I was politicians, and politicians have a habit of recovering immediately. So I recovered myself and I said, now I am asking you one question. I will ask you one question. Just answer that. How to become a good IPS officer? How to become a good IAS officer? How to become a good judge? How to become a good lawyer? How to become a good medical practitioner? Now it was his turn to be on back foot. He said, Sir, I don't understand what you are asking me. I'll tell you. I said, there is nothing called good IAS or IPS officer. There is nothing called good medical doctor or medical practitioner. There is nothing called good scientist. There is nothing called good lawyer. There is nothing called good judge. To become a good judge, to be a good lawyer, to be a good medical practitioner, to be a good IPS or IAS officer, you have to be basically a good human being. If you are a good human being, you can be anything. You can be good politician also. You can be good medical practitioner. You can be good judge also. But you have to have that good human being. If you are not touching human hearts by your actions and by your behavior, you are of no use. That is what our research should be directed towards. That is where we have to do the research again and again. Let us try to be good human being. And all that research which we are doing here or anywhere else in our labs, that will be certainly giving us good results which are directed towards human beings. Let us touch those human factor in our life. We have to touch that human factor. We cannot leave it aside. If we are doing this, I think we are successful researchers. We are successful scientists. We are successful medical practitioner. Everything can be attained. But one precondition is that I have to be a good human being. If I understand others, their factors, their apathies, then I will do it research in my lab with more seriousness, with more attainment, with more targeted factors, and with more good results. That is what we need to do. This particular conclave of 3 days will certainly look into this factor. We have to look into this factor of human touch, human factor. Being a human myself, I also want others to be in human way. I also be presented myself to them in a human way. So that has to be taught to me again and again. And then my research, then my all scientific innovations, or then all my startups, as were mentioned here, all will be directed towards that. Ultimately, all our efforts are for that human being. As I have said at the outset, all our efforts are for that human being. That has to be done. That is the achievement. And then we will be attaining the good old saying of this country, this culture, that is Jivet Sharada Shatam. Jivet Sharada Shatam, let us live 100 years. Not only myself, all others. And for that, we need to change our lifestyle. The lifestyle which we are attaining today, which we are performing today, has brought us all apathies, many apathies. Now we require a different therapy for this. For all those apathies, a different therapy, and that therapy which you are sitting here will be evolved by your intellectuals, by all your efforts, and ultimately we will be targeting the human being to get him better life than yesterday. That is the aim of our all conferences. That is the aim of our all deliberations. I hope you will certainly march in this way, certainly work in this way, and certainly think in this way so that we achieve for the person we call human. That's all. Nanni, namaskaram.
Thank you, Honorable Governor, for your gracious presence and valuable words of wisdom. It's now the moment of honor. I now invite Dr. Dina Das CS to adorn the Honorable Governor with a ponada and Professor Dr. G.M. Nair to present the memento with a token of respect from the Delview College of Pharmacy and Research Center Autonomous.
To conclude this inaugural ceremony, we have Dr. Shijikumar PS, Principal, the Delview College of Pharmacy and Research Center, who is an academic leader with extensive experiments in pharmacy education and research, who has been instrumental in guiding our students and faculties. With utmost respect, I invite Dr. Shijikumar PS for vote of thanks.
Most respected Honorable Governor of Kerala, Sri Rajendra Swishanath Arlekar sir. President of Function, Professor Dr. G.M. Nair, Sri Pradeep sir, Dr. C. Ramchand sir, Dr. Anandra Ramakrishna sir, our CEO, Dr. Shaiju David Alfid, our Chairperson, Dr. Dina Das ma'am, our Directors, Sri Dibin Das and Edin Das, our respected speakers, delegates, most respected faculties of other institutions of various states, my colleagues, dear students, press and media, a warm good morning to one and all. Today I stand before you with great pleasure and immense pride of the inaugural session of Clinipharmacon 3.0 at our institution. Today we mark the beginning of an extraordinary gathering where leading minds from across the world come to exchange their knowledge, the skills, insights, and innovation in the field of precision medicine, genomic to healing, redefining therapy. First and foremost, it's my proud privilege to extend our heartfelt gratitude, our Honorable Governor, whose visionary leadership based on his specifically on skill building and youth empowerment, development of knowledge-based inclusive society, active citizen participation in nation building, cultural balance with a modern scientific outlook and society harmony and democratic values that will well fit with the theme of these 3 days international conference. So purely proudly we can say our theme is will fit to your all the experiments and all the innovation and research will leads to definitely to the human being well-being of our human to lead the society, sir. We are grateful for your keen interest in academic excellence and constant support to our institution and to your guidance serves as a beacon of young minds in this pharmaceutical field. We convey our sincere thanks to Your Excellency for sparing your valuable speech and for blessing this program with your august presence. Thank you, Your Excellency. Thank you, sir. Next, our President of this function, Dr. G.M. Nair, sir, Advisor and Chairman of our Governing Council, whose visionary leadership have really made this conference possible. Sir, your gracious presence, thoughtful presidential speech, and encouragement to research-driven education have greatly elevated the status of this event. Thank you so much, sir. Our chairperson, Dr. Dina Das ma'am, he has been the source of visionary support, educationist, and critical thinker, and who leads all the aspects of steps of Clinipharmacon 3.0. Thank you, ma'am, for your highly thought-provoking welcome speech. Thank you, ma'am. Next, I express my sincere gratitude to Dr. Anandra Ramakrishnan, Director, CSIR NIST, for his valuable presence and support. Such leadership in scientific research and innovation continues to inspire the academic and research community. We deeply appreciate your encouragement and guidance, sir. Thank you so much with us, sir. I extend our heartfelt gratitude to Dr. Ramjan sir, CEO of Well Genome, for his esteemed valuable contribution to this event. Though innovation and dedication, he continues to bridge the gap between science and the real-world healthcare solution. We sincerely appreciate your support and guidance, sir. Thank you so much. We extend our sincere thanks to Dr. Sri Pradeep KS, convener of State Level Bankers Committee Kerala, for his support towards the scientific research and innovative programs of Delhi College of Pharmacy and Research Center Terminus. Thank you so much for your support. And the great personalities behind this international conference, with no words, our beloved director, our MD and CEO, Dr. Shaiju David Alvi sir, our director, Dr. Devin Das, and Sri Dildas sir of Delhi College, who are always keen and hardworking for this development of our institution. I extend my sincere gratitude to all directors and MD sir. I extend my heartfelt gratitude to the organizing committee, delegates, faculty members of all institutions, other institutions, my dear students, our associates, sponsors, press and media. For each and everyone gathered here, I wish you all success and inspiring conference. And it will be a powerful initiative to strengthen the clinical pharmacy practice, promote research excellence, and contributes to safer and more effective healthcare to society, as our Honorable Governor said. Thank you so much. Jai Hind.
Thank you, sir. As we conclude our inaugural ceremony, I request everyone to stand for national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
will commence with our scientific sessions, while few of you can go and have tea. Good morning, respected dignitaries, esteemed speakers, and dear delegates. It gives me immense pleasure to welcome you all to this conference centered on a powerful and transformative theme, from genes to healing, redefining therapy.
Starting with the very first section, we are privileged to have Professor G. Mohandas Nair, Advisor and Chairman, Governing Council, the JV College of Pharmacy and Research Center, and President of Kerala Academy of Science, and Dr. Shijikumar P.S., Principal, the JV College of Pharmacy and Research Center, Autonomous, as the Chair. I would also like to extend my inviting to the co-chair, Dr. B. Shashidhar, Senior Principal Scientist, CSR, National Institute for Interdisciplinary Science and Technology, and Dr. Christy K. George, Professor and HRD, Department of Pharmaceutical Chemistry, Pushpagiri College of Pharmacy, Tiruvalla.